And the last few gram-negative bacteria that are the gram-negative bacilli that cause issues are anaerobic. So they're strictly anaerobic. They're not going to grow well if oxygen is present. A lot of anaerobic gram-negative rods are normal flora. So not every bacteria is bad. There's a lot of normal flora that are anaerobic, that are normal flora of the digestive tract, of the reproductive tract, of the respiratory tract. All totally fine, all do great things there. Some of them inhibit the growth of other organisms. Again, they kind of have taken hold and are not going to allow other things to grow there. Some of them help make vitamins and vitamin precursors. Some of them aid in digestion. However, if they go somewhere new, that's when they can become an issue. So there's two main anaerobic gram-negative rods that cause issues. The first is in the genus of bacteroids, and it's part of the normal flora of your intestinal tract as well as the upper respiratory tract. The main bacteroid that does cause issues is Bacteroides fragilis, and it has a lot of virulence factors that allow it to cause a variety of conditions. And again, it depends on where it goes, depends on what kind of issue you have. If it gets into the abdominal cavity, such as during medical procedures, it can cause abdominal infections. If it gets into the reproductive system, usually in women, it can cause genital infections. If it gets into open wounds, it can cause wound infections. Treatable, metronidazole is usually the main antibiotic that's used and prescribed when there's an infection because it seems to work the best. But again, it's preventing it from getting places that it shouldn't be. One note between the two anaerobic gram-negative rods, bacteroids and the next one, this one, Bacteroides fragilis, can grow on plates that contain bile. Because it is part of the normal flora of your intestinal tract, it has evolved that it can grow in the presence of a bile substance since there's bile in the intestinal tract. Unlike the next one, the other anaerobic gram-negative rod that can cause issues is Provotella. Provotella is part of the normal flora of the urinary tract, the genital tract, or the urinary tract, the reproductive tract, and the upper respiratory tract. It is not part of the normal flora of the digestive tract, so it is sensitive to bile. It will not grow in the presence of bile. So it's an easier one to help distinguish which bacteria it is. If you grow it in an anaerobic environment, you know you've got one of these two bacteria. Will it grow on a plate that contains bile or not? It also has several virulence factors that allow it to cause disease, but usually it's because it goes somewhere where it's not supposed to go. It can cause sinus infections, ear infections. If it's part of the respiratory tract, it can get into your mouth as well. And it can cause periodontal issues, including cavities. If it gets into open wounds in the reproductive tract, it can cause gynecological issues. It can get into the bloodstream and cause brain abscesses, and it can cause abdominal infections. So really, again, depends on where it goes. Treatment, usually it's removing infected tissue and a broad spectrum of antibiotics. Usually some type of carbapenem works best. It is a little, because of its virulence factors, it can be a little bit more harmful than bacteroids, which instead of just giving an antibiotic, it's usually removing infected tissue as well as an antibiotic. So those are the last two of those gram-negative bacteria in this PowerPoint.